Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation, Managing Diabetes, presented by Dr. Thomas Collins-Pallet, Family Medicine Specialist with Washington Township Medical Foundation. Dr. Collins-Pallet is board certified by the American Board of Family Medicine and provides care from newborns to the elderly. In family medicine, Dr. Collins-Pallet is passionate about primary care medicine. This specialty gives him the privilege of being able to look at the whole patient in order to provide comprehensive, full-spectrum care. Please welcome Dr. Collins-Pallet.
Hello, everybody. So I'm going to be talking a little bit about managing diabetes. To give an overview of what we're going to be talking about, we're going to briefly go over what diabetes is. We're going to talk about some general principles for diet, things we can do to hopefully help improve control for diabetes. I'm going to run through some popular diets and kind of their pros and cons. We'll talk about why exercise is important. I'm going to briefly cover some medications that are kind of exciting and allowing us to do more, and then kind of summarize everything. So to start, for diabetes, before I get into the types, I think it's important to just go through what should normally be happening. So when you eat food, your body sends a signal to your pancreas. And one of the things your pancreas does is it releases insulin. When it does that, the insulin basically pushes sugar that's in your bloodstream into your cells so that your cells can use the sugar for energy. And so diabetes in general is a problem with that system. Type 1, which a lot of the stuff I'm going to be talking about today, it can help, but it's a little more complicated, is where insulin secretion is basically absent. Normally this is because somebody's body has attacked the beta cells in the pancreas that produce the insulin. So everybody that's type 1 ends up on insulin because we need to supply it to them. Type 2, which is the one I am going to be talking more about today, is really resistance to insulin. And that is commonly attributed to things like being a little heavier, regularly eating foods that are very high in sugar, not exercising regularly, that kind of thing. Now there's a lot of gray type diabetes that mixes in between these two, but those are the two classic types. And so to get into dietary changes, I'm going to start with carbohydrates. So these are things like sugars in fruits, milk, sodas. You have them in pastas, everything like that. And there's two major categories of them. There's the simple carbohydrates, which if you drink a Coke, right, you're getting a lot of sugar, a lot of sucrose, and that basically turns straight into blood sugar, right? So you drink soda and it will dramatically increase your blood sugar, which, as you can imagine, is not good for diabetes. The more complex carbs, things like whole grains, starchy vegetables, dried beans, those tend to have more I guess, gradual release of sugars when you eat them. So you are not having that same level of a spike. And then also in the complex carbs is fiber, which I'm going to dedicate a slide to in a little bit, which is great for a lot of reasons. One of the more important ones is it kind of slows down your digestion. So it also prevents sugar spiking, as well as having some other benefits. To give you guys a little bit of a visual on carbohydrates. So these are all complex carbohydrates, all of these molecules here. As you can see, there's more complexity and less complexity. And those simple sugars I was talking about, that's a single molecule here. So when you have a soda, you're getting a whole bunch of these single molecules, and this is the energy that needs to be broken down. When you eat something like beans that have more complex carbs, you're getting something more like this. And so the time it takes to break this down into energy is a lot longer, and so you get a much more gradual release. So it's much easier on your pancreas, and generally better for you if you have diabetes. And that's where we get into something called the glycemic index. So that is a measure of how quickly your sugar will rise when you eat certain foods. There's some pretty decent evidence that it helps, particularly type 1 diabetics. And in general, if you're focusing on a low glycemic index, which means it's not increasing your blood sugar quickly, if you're focusing on those foods, then you tend to get more fiber, more complex carbs. And how to use this, generally I'm telling people, if you're in the grocery store and you are picking between, say, two different fruits, like apples and bananas, and you're like, I wonder what's going to be better for my diabetes or my sugar levels, you can look up what's the glycemic index of an apple versus a banana, and you will find that apples have a lower glycemic index. They aren't going to spike your sugar as much as a banana. So you can make those decisions in the grocery store with this type of measure, and I think that's a kind of practical way to use this. And then that kind of leads into fiber a little bit. Glycemic index has fallen a little by the wayside in terms of how much we push it, because we've got a lot of evidence that it's really fiber that makes the biggest difference. So when you're eating low glycemic index foods, it's the fiber that's actually getting you the benefit. Your body is very slow to process fiber. It's a complex carbohydrate. You can't really digest it. It stays in your stomach for a long time. And so when you eat it, you will feel full, and you'll feel full for longer. If you eat a candy bar, right, you're going to get a good spike of energy, and then you're going to probably be feeling hungry again in the next hour or so. Versus if you eat, say, a bran bar, you aren't going to get that necessarily huge spike in your sugar, but you are going to feel full for a lot longer. Other benefits for it that we know for sure, cholesterol and diabetes are two combinations of things we don't like. So high cholesterol means you're higher risk for things like heart attack or stroke. Having diabetes makes you higher risk for heart attack and stroke. And so the fact that fiber can help with both these things is pretty great. To go through other kind of macronutrients, fats in general, a lot of people, I think, get really concerned about how much fat they consume. I think quality is much better than quantity when you're focusing on fats. So certain fats like trans fats, things in shortening, baked goods, cookies, cakes, stuff like that. Those are not as good for you. They make you more likely to have heart disease. And then there's better fats, the mono or polyunsaturated fats. You get those in fish, olive oil, nuts. That's why a lot of the time we're trying to push, fish, nuts, stuff like that in people's diets. And then there's the ambiguous ones, saturated fats, which we kind of aren't totally sure if they're helpful or harmful. And then going through just in terms of proteins, a big one we get concerned about is red meat. Red meat's been linked to a lot of problems, including colon cancer, increases your risk of heart attack, stroke, that kind of thing. And so for proteins, we tend to push more lean meats, more fish, more beans, more peas. Again, kind of tying into the fiber thing. So that's an overview of the macronutrients. To get in a little bit into popular diets, so I'm going to go through 3 just briefly. Go Low is one you guys may have seen ads for. Very briefly, it kind of encourages a calorie deficit. So you're going to be losing weight, and then it tries to promote some of the healthy dietary habits I talked about. Make sure you're exercising regularly. And then it also promotes this supplement, which if you look on their website, they say you cannot use the supplement on its own. You have to do it in conjunction with healthy diet and exercise, which to me says maybe the supplement doesn't do too much. There's some evidence for some of the things in the supplement, but it's pretty limited, and in general, supplements are not very well regulated. So I'd be a little cautious with that one. Intermittent fasting is just kind of a style of eating that I've had some patients have success with. And it seems to help people that are having trouble with snacking and binge eating, and they need a pretty regimented schedule to follow. I think it is a very good option for those people, because then they don't really have to pay as much attention to what they're eating. They just have to pay attention to when they're eating. That's not to say they shouldn't eat healthy, they should. But if you're going to choose or you're having difficulty with one, this could be a reasonable option. And then Weight Watchers, which I think really just simplifies calories more than anything else. So it uses a point system, again, encouraging those healthier habits, trying to get a calorie deficit for people so that they will lose weight. All these diets are, you may notice, doing very similar things. They're getting you to lose weight with a calorie deficit, promoting some healthier habits, making sure you're exercising, that kind of thing. And so in general, for diet plans, I think the best one is something you can follow forever. And so I tend to promote doing smaller changes you can live with for 5 or 10 years, because that's going to have a longer term impact. I get excited when people lose weight for 6 months, but unless we have a plan for 5 years, I'm worried that weight is going to come back. And so it is all about lifestyle change. You're going to hear a lot of doctors talking about lifestyle change, because it should be the rest of your life. Going into why exercise can be helpful for diabetes. If the issue is we have a bunch of sugar floating around in your bloodstream, one of the best ways to do that or help that is to consume that sugar, right? So if you're exercising, all those cells that are not really responding to the insulin or just not absorbing that sugar, they're going to consume their sugar, and they're going to say, where's all that energy? And so it'll drop your sugar levels. It'll make your cells more sensitive to insulin. We've got pretty good evidence for that. If weight is an issue with your diabetes, it can certainly help you lose weight. And the recommendations in general are to aim for about 150 minutes a week of moderate intensity exercise. So that's trying to get your heart rate around 70% of its max. But any exercise in general here is better than not exercising at all. And I've had patients, poorly controlled diabetes, they start doing something every day, and it can make a big difference, right? It just helps their pancreas just a little bit with consuming that sugar or dropping down those sugar levels. And so I think it's particularly important for people with diabetes. Going through different types of medications, and I'm not going to go too in depth into this because there's a whole bunch of options, but there's two classes that are relatively new and kind of exciting in terms of how we can manage things. One of them, the class is called GLP-1 inhibitors. They initially were made to help control your sugar because they help your body process sugar, but they found that they also help you feel more full. They can help you lose weight. The generic names you can see up there: semaglutide, liraglutide. There are the brand names you may have seen ads for, things like Ozempic, Wegovy, and they've even had some approval just for weight loss medications. So these are pretty exciting, the fact they can help with weight and also with diabetes as well. And then the other class of medication, they're called SGLT2 inhibitors. There's a channel in your kidneys that is responsible for exchanging salt or sodium and glucose, because normally our bodies want to hang on to as much energy as possible, and it blocks that channel, so you pee out sugar, which, as you can imagine, is pretty helpful for diabetes, and it may actually help blood pressure as well, which is why they think it helps heart attack and stroke risk. It also can help with weight, just because, again, you're peeing out sugar. So it's pretty exciting, some of these new meds. Overall, just to summarize, diabetes is a mismatch between what your body is doing in terms of insulin and sugar. Diabetes or dietary changes can definitely help with control. Regular exercise, I think, is very important, specifically for diabetics. And there are some newer medications available that are quite helpful. I can provide references on request. Any questions?
Thank you, Doctor. Yes, we do have some questions. The first question is it possible to reverse my type 2 diabetes?
So once you get the diagnosis of diabetes, you have that diagnosis, and you're always going to have the diagnosis. We normally view it as well-controlled diabetes or poorly controlled diabetes. And some people, they can get it well-controlled just with diet and exercise. Some people need some medications. So it's certainly possible to get it under control. You can't ever get rid of the diagnosis, though.
Okay, and the next question, I'm currently taking oral medications, although my A1C is still high. When should I consider insulin-type medications?
So the nice thing about the new meds is we don't have to jump straight to insulin. Type 1s are, they're always on insulin, but type 2s, we've got plenty of new options. And a lot of the older medications made you gain weight, and that was not great for type 2 diabetics that may already be having weight problems. These new meds help you lose weight and help with the diabetes. It's really, great options that are not insulin, for sure.
Okay, and the last question we have today is, do you have any books or resources you would recommend on diet and exercise programs for diabetes specifically?
So Dr. Kata did a great presentation recently, and I'd recommend you guys take a look at that. That was a pretty good one. Definitely got into some details, which was great.
That's great. And as well as Dr. Kata's presentation and your presentation can both be seen on the Washington Hospital website. If you click on Facebook and go to videos, you'll be able to see all kinds of information about diabetes there. So thank you for bringing that up. That is a great resource for people. And that's the last of our questions. And thank you, Dr. Collins-Pallet, for this insightful presentation and for joining us today. This concludes our program. And thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.